causes nasolabial folds? So the nasolabial fold is the line that develops between the nose and the mouth, often called smile lines. What causes this are there are different compartments in the face that contain fat, and over time these areas and compartments will be not as full. As we know with time, things tend not to be as full and descend. And so this descent of this fat that's in the mid-face or around the cheek area descends over time, folding over this area between the nose and the mouth, making that deeper and more pronounced. Also, the loss of volume in the face contributes to that area losing that volume and becoming more noticeable as a low place in the face. What is a nasolabial fold? This is a low area or a line between the nose and the mouth, also called a smile line. And these are more prominent in some people than others, just depends on your anatomy and your aging process. Can nasolabial folds be reversed? Nasolabial folds can definitely be improved, and there are a lot of different things you can do to improve the folds. It's hard to say they can be reversed exactly, and I would want to know what that person wants whenever they say reversed. Do they mean go back to how they were when they were younger? Because yes, we can definitely do that. You do that with things like a facelift, a mini facelift, non-surgical skin tightening, anything that lifts that cheek tissue back to where it used to be. Can they be completely taken out to where you have no nasolabial fold? That depends on your anatomy and how deep they are naturally. Sometimes that doesn't look very natural to not have the fold at all, but you can improve it to where it's a lot softer and not noticeable. How do you fix nasolabial folds naturally? The most natural appearing way to address nasolabial folds is to lift the mid-face or cheek skin and tissue back to where it was when you were younger. So this can be a mid-facelift, a mini facelift, or a facelift to lift that back naturally and look the most natural and most youthful for you. There are ways to lift it with things like threads that I personally don't use because I don't think they lift enough or lift for long enough to make it worth it. There's non-surgical skin tightening or minimally invasive skin tightening that tightens that skin, and so you see less of that fold. And then there's also injectable fillers, which can fill that area and make it softer and not as noticeable. So when you say naturally, the lift is really the most natural way to address the nasolabial folds, but the easiest way is probably with the injectables. What is the best for nasolabial folds? This depends on what you're looking for, the degree of improvement, and the amount of downtime that you have. What restores the nasolabial folds to what they were when you were younger is a facelift, a mini facelift, or an upper facelift, all of these being a surgical way to lift this part of the face or the cheek between the eye and the jawline. Other ways to address this are non-surgical skin tightening. This gives you very little downtime for a nice improvement. This happens over time, so if you don't have a lot of downtime and you're okay with this taking a few months to get there, this may be the best way for you. The other way is with injectable fillers. These are natural things that are already in your skin. That is injected into the folds and into the cheek to give you that more natural, soft appearance to address the folds. This you see right away, and this can last for 6 or 9 months, up to 18 months with a simple office visit. So that may be the best for you if you want something immediate and you want this to last around that 1 to 2 year mark. So it kind of depends on what you're looking for your nasolabial folds, what is the best way to go. Have questions? I help people like you every day. Just schedule a consultation at drangela.sturm.com. Thanks for watching.